This Good to Go segment is sponsored by Spectrum Health Medical Group.
Women of a certain age will tell you hot flashes are a thing. And for some women, they can be a real nuisance. Natasha Peoples is a nurse practitioner with Spectrum Health, and she is here to talk with us about the basics of hot flashes. Good to see you, Natasha.
Hi, Catherine. Good to see you.
Tell me, when can women expect hot flashes to set in, and for how long do they experience them?
Sure. So, not every woman experiences hot flashes, but about 80% of women will have hot flashes some point in their life and usually through the menopause transition. So, hot flashes can start anywhere from the perimenopause when periods start to get irregular, all the way until after the periods have stopped for a year or more. Um, the average age of menopause for women in the United States is 51, but can start anywhere from the mid 40s to the late 50s, even early 60s.
Mm.
Hot flashes can last, about an average of 4 to 7 years, hopefully not at their worst, not as intense as they can be.
Yeah.
But a small percentage of women experience hot flashes for up to 20 years or more.
Oh my word.
I know. Yeah.
What causes them?
Yeah, so it's really interesting and not 100% fully well understood, but there's a place in the brain, the hypothalamus is where our thermoregulatory, so our thermostat lives. And because of the way our hormones change as we go into menopause, the thermoregulatory center changes. It gets a little bit dysfunctional. And so our body thinks it's overheated with a small increase in core temperature. And a hot flash is your body's way of trying to cool itself down. So you get a little bit warmer or have a little flushing, and all of a sudden, you're full on hot flashing.
Kapow.
Yeah.
Are there risk factors or triggers that might impact?
Sure. Yeah, we definitely see certain patterns for hot flashes. Women who smoke or have a sedentary lifestyle are at an increased risk, as well as some factors you can't necessarily control. Women in a low socioeconomic status or women of African descent have a higher risk. Women with obesity, and interestingly, women who are experience more intense premenstrual symptoms are
Mhm.
at a higher risk for hot flashes in the menopause. As far as triggers go, again, some of them you can control, some of them you can't. Things like caffeine and alcohol will often bring on a hot flash, sugar or certain foods, spicy foods. But then, warm temperature, a warm room, or an extra layer of clothing, stress, like a little bit of adrenaline, will often bring on a hot flash as
Mm.
well.
Are there treatment options?
There are lots of treatment options. So we talk every day with our patients about, for the foundation of what we discuss, it's lifestyle. What are the
Mm.
things you can do to make a difference in your symptoms? So it's active, exercise, healthy diet, and so forth, drinking lots of water, watching your caffeine and alcohol intake. Um, but there's also, good medical options. So hormone therapy is fraught with controversy in the wider world, but something that we talk about every day with our patients, just exploring as an option, and in consideration of their own safety and, whether or not it's a choice they want to make. There are some off-label alternatives, so medications that we use that just tend to help women with hot flashes. Some antidepressants can do this. There's a blood pressure medication that sometimes helps. There's a nerve pain medication that sometimes helps. So it really depends on the independent circumstances for each woman and what her best choice is going to be.
Yeah, is there a point where it's, medical help should be sought, where we muscle through it because it's just normal, but then some women need to reach out? Is there like a line where we say, go to help?
Yeah, yeah. I think that the biggest bottom line is that women don't need to suffer. So if you're suffering, please reach out for help. There is a lot of misconceptions out there, but there's a lot of good treatment options too.
All right, some terrific advice. Natasha, thank you so much for spending some time with us.
Absolutely. Thanks, Catherine.